everyone. Thank you for joining today. I'm going to give it a few minutes for people to get in and get settled, and we'll get started. Still seeing numbers go up, so we're just going to give it one more minute and then I'll get us going. Like the numbers have slowed to a trickle for now, so we can go ahead and get started. So thank you so much for joining us today for our webinar titled Centering Lived Expertise, How to Meaningfully Elevate the Voices of People Directly Impacted by the Criminal Justice and Behavioral Health Systems. We're very excited that you're joining us today. We're really excited about this topic and to share with you what we have to cover today. Next slide, please. Okay, so this is our agenda today. I'll start by giving us an introduction and introducing everybody that is on our panel today. We will then talk about the importance of community engagement and how that really lays the foundation for engaging people with lived experience and expertise. We will then talk about a project that we recently completed that was related to lived experience, where we brought together a lived experience advisory panel. And we will share with you some of the things that lived experience advisory panel shared with us around key considerations as to how to meaningfully and effectively engage with people with lived experience. And then we will have York County, Pennsylvania, share their experience, bringing in people that have lived expertise and bringing that into the work that they're doing locally. And then we'll close out with questions and reflections. In the bottom of your screen, you will see a Q&A button. Please feel free to drop comments and questions in there. That way we don't have to toggle back and forth between the chat and the Q&A, and we will try to address those at the end as time allows. Next slide, please. So I'm Megan Davidson. I'm the program director for Stepping Up at the Council of State Governments Justice Center in our Behavioral Health Division. I'm joined by my colleague, Kate Reed, who is a project manager on the Stepping Up team within CSG. And also joining us today are Becky Lochner and Catherine Gruber, representing York County, Pennsylvania, one of our Stepping Up innovator counties. So we're very excited to have them share with you their experiences. Also joining us is Orleni Rojas, a senior manager with the Center for Effective Public Policy that has been partnering with us along the way as we're doing our best to incorporate the voices of lived experience in our work here at CSG. Next slide, please. So the Council of State Governments Justice Center is a nonprofit, nonpartisan organization that combines the power of membership, serving state officials across the 3 branches of government, with policy and research expertise really designed to, a lot of our work focuses on developing strategies that increase public safety and strengthen communities around the country. Next slide, please. So how we work is we bring people together, we bring stakeholders together at the national, state, and local level to really think about how we can meaningfully reform the system, improve our responses to people that are interacting with the criminal justice system. We drive the criminal justice field forward with original research. We build momentum for policy change. So a lot of our work also will center around policy reform, and we provide expert technical assistance. So next slide. Our main goals within the Justice Center are to, perform work that supports with breaking the cycle of incarceration, advancing health, opportunity, and equity, and using data to improve safety and justice. So all of our work really centers around these 3 goals. Next slide. And one of the things that we really prioritize with the Justice Center is really advancing racial equity internally and externally, quite frankly, through our work. So we really support efforts that dismantle racial inequities and prioritize equity across all of the work that we do. And that really connects to the work that we're going to talk about today with regard to lived experience, as those things are truly well connected. And with that, we can go to the next slide. The other piece that's really important to be thinking about, or something we wanted to put front and center as we get started here today, is that BJA, the Bureau of Justice Assistance, is one of our primary funders for some of the work that we do here at the Justice Center. And they have done a lot and continue to do a lot in the area of lived experience and specifically around peer recovery support. So we wanted to share these resources. If you have not taken a look at this website, specifically the COSIP website and the resource center there, please do. There's a lot of great resources there around peer recovery and how to incorporate peer recovery and peer support in the work that you're doing. Next slide, please. So I'm getting ready to pass it over to Arlene. I'm very happy to do that. She's going to talk about community engagement and her work in that space around with introducing the topic of lived experience and the importance of that work. Arlene?
Thank you, Megan. And good afternoon, everyone. My name is Orleni Rojas, as mentioned before, and I've been partnering with the Justice Center for the last 3 years on racial equity, applying a racial equity lens and incorporating the voices of people with lived experience and expertise, as well as broader community engagement. And so we thought that it would be particularly helpful to start here on the importance of community engagement. If we can go to the next slide. And in particular, in the work that I do at CEPP and the work that I've done in my career for the past over 15 years, it's really around community and bringing the voice of community specifically to criminal justice, work that we've done in the criminal legal system. When I began my career, I worked very grassroots at New York City in the Bronx, working with particular communities there on programming and community connections to programs, both for people that were coming in through the local criminal system, as well as programs that deter people from coming into the system. Very early on in the work that I did there, I saw that there was a limitation in how we engage community. We were only doing it for things that we thought fit within their purview. And we never really were making meaningful connections or building bridges between community and the stakeholders that were in charge of making policy, in charge of determining practices, determining ways in which responses for community members and for community areas would happen. That was all very much happening in policy spaces where that voice was absent. And we saw what the consequences of that were. There were times when we had the best intentions, had an abundance of resources, plan what we thought in those rooms would be the best solution to the problem or the best help to people in community and people from community in the system. And then we would run into this thing of like underutilization of whatever it was that the program was or the service was that we were creating. And so that taught me early on that was because there was an important component and part of the process that was missing, and that was community voice, the voice of the people that this would be impacting. And in terms of implementing, in terms of tracking outcomes and getting to success, we just didn't have that was a missing piece of that puzzle. And once we started identifying that and bringing that voice and that input and that perspective, things definitely flowed much better and had much better outcomes. And so when I talk about why engage the community, I'm like, why engage the community in criminal justice, in the policy work that we're doing? And we traditionally do it to gather information. We do it, as I mentioned from my story, to improve outcomes, to build capacity. One of the things that we also don't understand is that part of that process is what is our capacity, and we tend to be very tapped out working in this area. And one of the things that bringing community and engaging with community brought was a broadening and a building of capacity so that we could do things that were more far-reaching, because we had more people at the table, more manpower, and a set of resources that we weren't tapping into. And those are resources that are within the community. And then to promote what resources are available, both, again, internally within systems, but externally within community, and how those resources can best be leveraged and used and collaborate together. Building relationships, that's huge. A lot of my work towards the latter part of my career in New York was around supervised release and coordinating pretrial services in 3 of the 5 boroughs. And one of the things that we recognized early on is that we had to build relationships with community, because the community perception of the work that we were doing in terms of supervising people with active cases, having them bring back to the community, and what the media narrative had been when someone was arrested, how that tied into whether it was true or not, the work that we were doing, supervising folks. Without that relationship, without giving community like the proper information about the work that we were doing, it created problems for us, and it created a loss of opportunity when those relationships weren't there in the work that we were doing. And then to share information, as I mentioned, it was very important for us to begin sharing information with community about what we were doing in that particular program. And so those were all things that builds into the why, the answer of why it's important to engage community, and in particular in the work that you're doing in your counties, in the intersection of behavioral health and the criminal legal system. It's even more important because that's a particular issue that is very felt, very deep in community. People are seeing people suffering from substance use disorders, from mental illness. There's a lot of stigma. There's a lot of misconceptions. In certain communities, there's a lack of access to programs and resources. And so there's a way to partner with community to kind of identify those things, but also come together and create solutions that are going to impact people that we want to remain in community rather than coming back into the system on a continuous basis. Next. And so what does that look like? What is community engagement in action? We talk about it in terms of like what the purpose is, again, to incorporate people's voices meaningfully in decisions and actions in public matters, and to address challenges experienced in the justice system, including gaps in racial equity. And then very importantly, values. What are the values that bring us to act on these things? And what are things that are important for us to come together and do this work, because it's work that some people see as additional, like not something that's part of being a stakeholder. If you're a prosecutor, if you're in law enforcement, if you are a county administrator, sometimes our lens is focused on our work, specifically within the system and not externally. And that's why sometimes we're not reaching out and engaging people and bringing them on, because we think that this is the purview that we've been hired or brought on to bring our expertise. But there are a lot of values that underpin the work that we do when we talk about public service, and particular building trust and enhancing community support for reform efforts. The work that we're coming here to do, wanting the community to understand that that's work that we're doing with them, not just for them. Gaining input and perspective from different levels, again, inside not just system stakeholders, but outside also community partners, victims, survivors, system-involved individuals, residents, and families. Next. And so in terms of putting community engagement in action, what are components of meaningful engagement? Engagement that's going to be reciprocal rather than being one-sided. And that's a huge important value of doing this work of engagement, understanding that it needs to be reciprocal, not just one-sided. And so for that, we know that the most successful things that go into, or the elements that go into it, are capacity and support of the agency or the entity that's doing the engagement, communication, both internally and externally, partnerships, how you're building partnerships within the system and system stakeholders, but also within community-based organizations, community entities, and people who are leaders in community, and then planning. Next. So in terms of capacity and support, does leadership in terms of the agency or the organization and staff have a good understanding of why engagement is important and of engagement principles and best practices? Do the staff have the time to lead community engagement as part of their job responsibility? Is there support within the agency for community engagement, such as funding, training opportunities, and commitment from leadership for this work? Next. Communication. Do you have an internal communication plan for your community engagement efforts? How is that being communicated to staff, the people doing the engagement efforts, people that are adjacent, and that the folks that are tasked with leading these efforts might need their assistance at some point of the process? Does the agency communicate with the public about its commitment to community engagement? What does it currently do to engage with the community, whether it follows up after the engagement happens? And that's a key component, being able to close the loop and not just go out there and request something from people, but then coming back and letting them know what was done with what was requested of them. Is the agency engaging with people with lived experience, which is a lot of what we're going to focus and speak about today. So the system, both people and their families, people who lived in neighborhoods that are impacted by their substance use, mental illness, and as well as victims and survivors of harm that's caused, again, with these issues that bring folks into the criminal legal system. Next. And then partnerships and planning. Is the agency already collaborating with organizations and individuals in the community? Or do these relationships need to be built? Are there structures in place for community engagement, such as community advisory councils, which we'll speak about today as well? Or do those need to be developed? And is there a plan for how and why the agency wants to engage the public, including goals, timelines, and actions? Next. And so this is an example of work that my organization has been doing, like putting all of those things together. And we have two initiatives right now that in particular focus on people with lived experience and expertise. And we'll talk more about that in a minute. And the first one is Opportunity Scholars, and that's very small program now that's focused on Maine, in the state of Maine, because in the state of Maine, people that are incarcerated have the opportunity to get their education while they're incarcerated. And so, focusing on that as an example, this is a group of folks that have been brought together, and something that's funded by the Mellon Foundation, to kind of like look at that and develop that and put policy recommendations and work with other system stakeholders in other states so that they see the importance of that and what the outcomes are of being able to provide an education to people who are incarcerated, so that then when they come back and then reentry is part of the process that they go through, it sets them up better for success and for reintegration. Another project that we have that's more recent is Justice Policy Consultants, and that's my organization has 16 individuals with very lived experience from across the country who are available to work on the projects that our organization has. And so we provide technical assistance in topics such as pretrial, community supervision. So those are folks that are coming to us and working with us in those projects at different levels, both in policy, programmatic, and practice changes, as well as trainings, providing technical assistance. So a whole host of the work that we're doing in this space, we now have a person with lived experience partnering with us and being brought into those spaces. Next. And so again, focus on why lived experience and expertise. Why have we, as an organization, and why are we here talking in particular about this? Why did the Justice Center put out the companion document to this webinar? If we could go to the next slide. Because lived experience versus lived expertise. As you'll hear from the lived experience advisory panel that CSG put together, one of the participants there had this very salient quote that's part of the document and that I've been using ever since. And that's, when we say lived experience, we mean knowledge based on someone's perspective, personal identities, and history. So lived experience is what is it that the person has gone through in their lives that has created like a knowledge base or information that can be tapped into or that person can share about that experience and put it in that context. Versus when we say lived expertise, we're talking about the summation of someone's perspective, personal identities, and histories, but that would be coupled with their professional or educational experience. And so it's going beyond just what the person experienced, but also now this is a person that has this lived experience in criminal justice, in experiencing the criminal legal system. But on top of that, now they've made it their work or their focus to, in either their professional experience, go and work on those issues, or in terms of their education, go and get a deeper understanding and training on issues that affect that particular or that correlate to that particular lived experience. And so that's the difference when we talk about lived experience versus lived expertise. Next. So what is the value of lived experience? It creates a vital link between people who make decisions within the criminal justice system and the individuals directly affected by their decisions. It provides unique and crucial perspectives that can inform the development and implementation of effective policies and practices that promote success. And so as we see here, another LEAP member quote, by actively involving individuals with lived experience, it is possible to develop more humane, effective, and equitable approaches to addressing behavioral health issues and reducing the over-incarceration of vulnerable populations. And that is very important to understand and underscore, because in particular in the work that we do with people with serious mental illness or people with behavioral health more globally, that's a very unique experience. And we are creating programs or building solutions to address something that is a very unique experience, and it cannot be a one size fits all. And so bringing in this perspective from different people, from their experiences, can help, because even though it's unique to each individual, there are common threats and common things that people experience within it. And so it's not just about the tapping into like what is the common thread amongst it, but also understanding that there needs to be space for that uniqueness in that person's experience. And so that's why working with peers, which has been traditionally a way to bring lived expertise and lived experience into this work, it's so crucial and has improved, as we've seen, outcomes for people. But going beyond that and bringing them into the policy table and bringing them into higher level decision making can bringing that perspective, it can also improve outcomes in other ways. Next. And so now I'm going to turn it over to my colleague, Kate Reed, so that she can speak more about the lived experience advisory panel.
Hi, good afternoon. My name is Kate Reed, project manager here at the Justice Center. I'm very excited to talk to you today about how the Justice Center became a part of this work. and then also highlight the specific project that actually brought us this webinar. Next slide, please. So back in 2022, the Justice Center received funding from the Langeloth Foundation with additional support from the Bureau of Justice Assistance to really infuse equity and lived experience throughout our behavioral health and justice initiatives. We partnered with several organizations, including C4 Innovations and also Orleni at the Center for Effective Public Policy. And they helped us form a lived experience advisory panel. We call it LEAP for short, with the goal that they will help develop guidance around elevating the voices of people with lived experience in the behavioral health and justice systems. So under C4's guidance and CEPP's help with recruitment, we interviewed and selected a group of 8 amazing individuals from across the country with diverse backgrounds. And they all have had direct experiences with behavioral health treatment and recovery supports before, during, and after incarceration. Next slide. And though they are not speaking on this particular webinar today, I did want to acknowledge them for all of their time and dedication to this work. Leo Davis, Manny Gomez, Philip Cooper, Edwin Suarez, Helen Skipper, Parker Chamberlain, Ronald Marshall, and Ruth Utnage. We thank all of them for their expertise and truly invaluable contributions to this work. Next slide. So once we had the LEAP formed, we worked with the members for several months. They shared their experiences, they conducted focus groups with other people with lived expertise, and that also included family members of those directly impacted as well. They reviewed several foundational Justice Center documents and offered an incredible amount of insightful feedback. And that was actually incorporated into the revised versions of these documents. Many of the LEAP members were featured in prior Justice Center webinars, and they also spoke at our internal behavioral health division retreat last year. Importantly, they also developed recommendations for how counties can more effectively engage people with lived experience and expertise, which is what I will touch on a little bit today. And I do want to add that each member was paid for their time at the federal subject matter expert rate. And anything that we asked of them beyond their, the scope of work and their allotted time, we made sure that we compensated them for that work. Next slide. So for the next few minutes, I'm going to talk about some considerations for centering lived expertise and meaningful engagement that were developed by the LEAP. Next slide. And these all can be read here. One of the most impactful products that came from the LEAP is this brief that was recently released. The purpose of this document is really to provide guidance around how counties and agencies can meaningfully engage and partner with people who have firsthand experience in these systems. You can read the full report on our website, but I wanted to just take a few minutes and walk through some of these key considerations. As I said before, these were all developed and written by the LEAP members. So these came directly from the people who have been directly impacted. And, that's really what makes this document beyond special and meaningful. Next slide. So one of the major points our LEAP members made was that there are many different ways to engage people with lived experience, and each has its own benefits and purpose. And as you can see on the screen, engagement strategies can range from, less intensive outreach. So that would be like administering surveys or holding public forums, to more in-depth activities focused on collaboration and shared leadership, such as an advisory board. It is important to note, though, that the value of the engagement is not necessarily tied to the intensity, duration, or complexity of the collaboration. Each situation, each project is very unique, and certain engagement strategies might be more appropriate for some than others. Next slide. So now I want to dig into what I think is really the meat and potatoes of this document. Successful engagement of any kind must be thoughtful, systematic, and reciprocal, like Orleni had said earlier, instead of extractive. People with lived expertise have often experienced negative consequences that may shape their perceptions of the world around them. So, this work really requires thoughtful considerations for effective engagement. Now, before even beginning this engagement process, organizations and leaders need to clearly understand their own intentions. What are the goals of the engagement? What resources are available to support the engagement strategy? What are the expectations, the risks, and the rewards for all parties involved? So beyond these initial questions, there are several factors to take into consideration, and they have been broken down into 3 different phases: setting the stage for success, meaningful engagement and action, and then following up and sustainability. So I'm going to walk through these in a little bit more detail, but folks must truly embrace these considerations if they really want to go beyond just, checking a box. And by following all of these guidelines, you will really have, more impactful and inclusive programs that will promote equity in the end. Next slide. Okay, so what are some of the things to consider when you are setting the stage to begin engagement? One is transparency. At the outset, you must proactively communicate the roles and expectations and any inherent limitations at the level of participation. And you must also be very clear in sharing information on the mission, the goals, and the tasks of the project. Trust. It is extremely important to intentionally address any concerns, and you have to maintain an open, two-way communication. It's also really important to collaboratively troubleshoot any challenges as they arise in real time as much as possible, as part of the initial outreach and engagement process. Diverse representation. Imperative to engage people with different backgrounds, experiences, and viewpoints. And it's really important to intentionally design any of the outreach, recruitment, and application processes so they are accessible, flexible, and inclusive. Awareness of stigma and discrimination. So organizations and counties have to go into this process fully understanding how their own policies and practices may reinforce stigmas or discrimination. And this can be done in a variety of ways through internal workshops or with third-party consultants, for example. Next is technical assistance and training. So organizations must also identify any internal gaps in knowledge or practice and determine if technical assistance in the space is really needed. They should also provide training and support to help folks with lived experience, fully engage in this process. And that this might include trainings like communication, policy knowledge, and advocacy skills. And then lastly, resources and accessibility. You must provide fair compensation for any type of engagement. And the recommended rate should be in line with subject matter expert rates. It's also really important to make sure that any logistical constraints or barriers are addressed. So that includes things like transportation, language barriers, scheduling issues, things like that. Next slide. So once the stage is set for this work, what are some things that organizations and leaders need to address when the engagement strategy commences? First, cultural competence. You must set rules and parameters that will guide meetings and create a space where people feel comfortable sharing their cultural identities. And it is really imperative to avoid making any assumptions or stereotypes, because that type of insensitivity can create enormous barriers and make people more reluctant to openly share their perspectives. Trauma-informed approach. So for people with trauma in their past, which is quite a few of us, participating in specific settings or, discussing certain topics may trigger some, emotional distress or re-traumatization. So you really must recognize that participation may require additional time and emotional support. And this might include providing, flexible schedules and other resources like education and access to mental health services. Next, we have an important one. You've heard this numerous times already, communication. So during engagement, you should encourage constructive dialogue and the sharing of different viewpoints. And this is important. Whenever possible, organizations should also act on the insights and the recommendations provided by the people with lived experience. And if not, they need to provide a rationale for not doing so. Communicating how their input has an impact is, extremely essential for building and strengthening that trust. Active involvement in decision-making. So people with lived experience need to be actively and equitably involved in decision-making at all appropriate stages of program and policy development, period. And at the earlier stages, those are arguably the most important. So really trying to bring in folks from day one is essential. And you can see that reflected in this quote from one of our focus group participants. Kimberly says, "For us, by us. Anything that is done on our behalf should have us included." And then lastly, feedback mechanisms. You must establish feedback mechanisms so people with lived experience can actually provide input on the process and offer suggestions for improvements. This also creates an opportunity to identify and address any issues that may arise during the collaboration or partnership. Next slide. And last, but certainly not least, what happens when the engagement is over? Many times it just kind of ends there, and people involved have no idea how their participation and insights have impacted the work. So there's essentially just no follow-up. So two important considerations here. First, meaningful follow-up. Make it a priority to acknowledge their contributions and share any deliverables or policy changes that actually came about from their participation. And they should always review and approve any resources that are derived from the engagement process before the project wraps up. And then second, evaluation and accountability. Organizations should regularly evaluate their engagement processes to really continue moving toward more meaningful participation. One thing that gets brought up quite often is tokenism, which means merely including people with lived experience for appearance's sake, without genuinely valuing their contributions. So oftentimes, a single person might be tokenized to represent an entire group of people. So these regular evaluations are incredibly important in order to hold organizations accountable, to avoid tokenism and really uphold meaningful engagement practices. Next slide. And quickly, this brief also highlights the LEAP as just one example of many engagement strategies. And it outlines some of the ways that LEAPs can be useful, including planning, implementing, and providing feedback on various programs or policies, recommending new and improved strategies, gathering information from community members and other folks with lived experience, and serving essentially as, very, very vital decision makers. Next slide. And lastly, I'm going to quickly highlight this checklist. We love our checklists here at the Justice Center. So the LEAP members who worked with us developed this list of key steps and considerations for organizations to successfully establish advisory panels of their own. This checklist can be accessed through our website as well. And you can see some of the different steps here, but I really encourage you to read it and use it when you're doing this work in your own communities. Next slide. Great. And at this time, it is my absolute pleasure to turn it over to Becky Lochner and Catherine Gruber, both from York County, Pennsylvania, who've been doing this work in their county for several years, even before we came out with this guidance. So we are extremely excited to have them speak with you today about the formation of their own community advisory board. They're going to highlight the impact it has had and continues to have on the behavioral health and justice work in their community. So Becky and Catherine, I will now turn it over to you.
Thank you. Next slide. So I am Becky Lochner, and I am the chairperson of our York County Community Advisory Board. I have been with the board since its inception, which actually this month marks 3 years for us, which is really, really exciting. And in that time, we've learned a lot of what Kate just discussed was part of the learning process for us as a board, as well as the stakeholder group that was a part of supporting us and partnered with us. Just to introduce myself a little bit as a person with lived experience, this is sort of how we talk at the board when we are communicating or when we have new members and we introduce ourselves. So I'm a person in long-term recovery. I've been in the York County recovery community for 18 years. I also am a certified recovery specialist. So I work in this field, and I am married to a state felon who is a reentrant. And he is also in long-term recovery. So what that means is when I speak at the board, I speak as a spouse of a reentrant, never as a reentrant myself. I speak as a person who is in long-term recovery here in York, and as a person who has been through a 30-day treatment facility. Outside of that, I don't speak about things that I have not experienced. I don't speak about a psych ward if I haven't been there. I don't speak about any part of anyone else's story. And we are very, very clear on representing our own experience. And the reason that I share that is because we've had a lot of discussion at the board level of whether or not we are representing lived experience or whether we're representing our own lived experience. And I think that, we've had to really clarify the difference between that. We are not here to share other people's stories. We are not here to be a collective of what others have experienced. And because if you've heard one story of reentry or of recovery, then you've heard one story. And so we are very, very careful to include diverse backgrounds, both in the individuals' backgrounds in their experience, as well as different racial backgrounds, different economic backgrounds, different educational backgrounds. So we tried to get a really good cross section of York County. But it does not mean that we represent all of the stories that are out there. And we've really gone through like a strategic discussion around that in the recent year and what it is we are representing. So next slide. And Kate, you really set me up for a great discussion here, because so much of what you talked about is what we have learned over time. And so I echo a lot of the things that you said, and I will share kind of how we incorporated those things as we have developed our community advisory board. So we started with a group of stakeholders that kind of brought us together. This was not born out of a bunch of community members with lived experience who said, hey, we want to advise others. We were asked to put this together by the stakeholders that are first listed in Black. So there were lots of different individuals who were part of the grant writing process to get this started, and Catherine Gruber was one of them, which she'll talk a little bit about some of that when I pass it over to her. But so we spent the first 18 months just meeting as a group of 12 members and those stakeholders highlighted in Black. And they brought different projects to us to advise on and give feedback. And I'll talk about some of those in a minute. But it occurred to us as we continued the conversation that, the board members themselves had feedback that we weren't necessarily being asked for. But at our meetings, different things were coming up, and we felt like, gosh, you know what? This is a continuous theme that has come up. We really need to get in front of maybe another individual who's not represented in those initial stakeholder members. And so it was, encouraged by those stakeholder members who are originally supporting us to go ahead and invite some of the people who are decision makers in our county to come and listen. And we've had really great receptivity to that. So the executive director of York County Human Services was invited to come to our meeting and hear about some of the different things that lived experience members have encountered either through their own work or their own lived experience related to housing and children and youth and criminal justice and all the different agencies across York County that are supervised by our Human Services Department. And he took that information and he, a lot of it he was aware of, but he got to put some of that human side to some of these issues that Kate talked about, giving some humanity to the groups of people that we are all working to serve. And I think that makes it much more real when they take that away and they see and they hear the struggles, the barriers, the challenges, the successes. And that it doesn't mean they work harder, but maybe they have someone's face in mind when they're actually, out in the community or in their office. We also were able to engage the director administrator of the York Adams Drug and Alcohol Commission, our SCA Single County Authority, was able to come and listen from the perspective of everyone at our table who has struggled with the substance use challenges of getting into treatment and finding the insurance to cover that and just the process of getting into treatment. Where do I go? What do I do? And they were able to hear directly from people who have experienced that. The next one that we really worked hard to kind of develop a reasonable agenda was with the York County prison staff. We had the warden there, we had the deputy warden, and we also had the director of recovery and reentry services. So it was really, really an overwhelmingly productive conversation. Our meeting is usually an hour and a half, and we invited these individuals, being cognizant of their time, to join us for 30 minutes, and they stayed for the entire 90. And we just had this terrific dialogue. And I will say that, some of the individuals on our cab came with guns ablazing, ready to be like, here are all the reasons that things are wrong at the York County prison. And when I was there, this happened or this didn't happen. And it was a super productive conversation where we facilitated just a really nice back and forth. And our board members left feeling like, wow, you know what? There's actually things going on there that I didn't even know were happening at the jail. And our jail staff left saying, wow, these are things we didn't even realize were needed or that were on their radar, but we were able to reiterate to them that they should be priority on that radar and help them kind of figure out the initiatives that they have on the docket, which ones need to be brought up and moved on. So that was a really, really great conversation that we had. I wrote a couple notes, Kate, while you were talking, just because so much of what you said really resonated with the group and the things we've encountered. We did have a question early on here in our Q&A chat of, engaging people, and then there's lots of organizations, and this could be said for anyone on this list here, getting the feedback and then not really implementing the feedback that was garnered. And so I think that's a valid question. I think a lot of people on this webinar probably have the same thought as, yes, this is nice in theory, but where does it go? And so I think the things that Kate laid out with the continuous feedback loops and seeing things put into action, the sustained engagement of individuals with lived experience is so important, because what happens is, if that falls, you've now lost that audience of people who participated. And there is nothing worse than feeling like you had this opportunity to be heard, and then really it was all just for show. And so we've gone through periods of that with the CAB, where it has felt like, are we just giving information to check a box? That tokenism that Kate talked about. Is this just engaging lived experience for the sake of engaging lived experience? Or are we engaging individuals with plans of using their feedback? And I think it's really important to follow what Kate laid out. The other thing is, we didn't ask just representatives from these offices that are on here. We didn't ask a staff member, a counselor from York County Prison to come over, even though they're boots on the ground and they probably could have engaged us in a great productive conversation. They're not in position to take any of our feedback and do anything with it. And so it was really important to us to engage these stakeholders at the top management level, so that when we were giving our feedback, it wasn't just for the sake of giving feedback. It was actually speaking to the decision makers in the organizations. So outside of York County Prison, the other added partnership that we have from just this past year is the York County Planning Commission oversees our pharmaceutical settlement money for the opioid settlement dollars. And so we are receiving some money for that. And we have created a York County Opioid Advisory Board that determines where those funds are going to be sent. And we have engaged the director of that committee so that she has access to 12 members of the community who can help her bring back information to this advisory board as they're making decisions on $1 million a year that is going to be coming to York County for the next almost 20 years. And so having the voices of this lived experience is not going to determine what projects get funded, but it is going to help that team determine what are the priority areas and what are things we may not have even thought of. And it's proven to be a really, really nice relationship. And I think the thing that we learned about this stakeholder group is we don't need to have all of these members at our meetings all the time, every month. In fact, we could have meetings for several months where we have no stakeholders there. We've learned how to kind of bring in the stakeholders when they have questions, when they need feedback. And when they don't need to be present. So it's not taxing them to have to be part of an ongoing commitment from their perspective. Next slide, if you would. So this is another way that we were able to really bring in this engagement into the community conversations, is that our board for a while was meeting, we meet on the fourth Thursday of every month. And while that is a great time and we're productive during that time, that's not really where things are happening. The things that are happening around our community are at all of these collaborative levels. So we were invited to have a representative from the CAB participate in each of these different groups, these collectives. So one of our members attends the CJAB meetings every other month. We have the trauma-informed response training that has happened all throughout York County, and it's been a big part of the work that we are all doing, is weaving the trauma-informed response into our care and services. And we were invited to have 2 of the CAB members trained in that training so that they can be, ambassadors of that concept out in the community as somebody who is just a community member, which was really, really awesome. And it gave those 2 individuals a chance to really become part of this team and this effort and this trauma-informed initiative that's happening. So we can champion that at the community member level. I won't read these all to you, but we have multiple collaboratives and advisory boards and coalitions, as I'm sure many of you all do too. And we've been invited to have a standing seat on each of these boards where if we have some turnover of any kind, we just replace this representative, and we always have somebody with lived experience from the CAB who is there. Now that does pose challenges because the individuals who are there, they have only their own experience. So as we were talking about before, we are not representing the voices of all 12 members. I sit on, in particular, since my background is in substance use and rehab, I sit on the York Opioid Collaborative Steering Committee, where I can talk about the experience that relates to me. I do not sit on the York County Reentry Coalition, even though I'm married to a reentrant and I went through that process of state parole with him. That's not my story. And so I don't participate on the Reentry Coalition Advisory Board as a member with lived experience. So we're very, very careful about what lived experience we are representing. And we make sure to send someone to each of these as an accurate representative of what is needed at those discussions. And then the ask is that those individuals come back to our monthly meetings on that Thursday and they share the things that have happened so that we're able to then process that, talk about it, and determine if we want to give any other feedback on these initiatives. Next slide. So some of the things that we've had a chance to give our feedback on, and I want to just cover some of the kind of the wins that we've had as a county, as a community, and all these partnerships. Some of you, on the call may be thinking, gosh, I don't even know what we would ask somebody with lived experience. I don't know what projects we would engage a community advisory board. And so here are some of the ways that we have been utilized in the last 3 years. And we're really ramping up for, much more than this as we've now gotten seats at each of these committees. But over the last several years, we were able to participate in a very long review of a planning document for a post-overdose response here in York County. There was a grant that went to our York Opioid Collaborative, and it was a planning grant. And so she spent a year pulling documents and best practices and different evidence-based practices that we could all look at. And I think that one thing that's really important is that as I talk about evidence-based and best practices, sometimes without realizing it, using that terminology with a group who has lived experience can be dismissive to our lived experience. And so when we would give feedback on this planning document and say, "Ooh, as you know, we have people in our community advisory board who have experienced overdose themselves, who have lost someone to overdose directly related to them, and had some very personal stories about what they would like to see in a post-overdose response from our county." And there's nothing worse than sharing that part of yourself and having professionals say, well, best practices tell us we should be doing it this way. The evidence-based, data that we have tells us that this is how we need to address this. And while that may be the case, and it's one story in a room versus a lot of data that was collected, it's just so important to utilize that with sensitivity, because there's nothing, like I said, there's just nothing worse than being told that a best practice somewhere else contradicts what you've been through yourself. So it's learning how to pair those best practices with your lived experience, which honestly, they're their own set of best practices. For me, what I have gone through is my own best practice. I've now been in the recovery community for 18 years. And so something that I have done in these 18 years has kept me drug and alcohol free. So if you tell me about a best practice that contradicts my story, that can create a little tension. So being really cognizant of when we throw the data around. We also had an opportunity to, you can see on the slide here, we reviewed tools for this project for racial equity. We were able to look at the survey tool and the interview guide that was going to be used in collecting data. And we were able to give feedback about how, ooh, that question is very insensitive, or, ooh, you don't realize what kind of emotions that might spark when you ask that, or, ooh, someone may not even have an answer to that question. You're asking them to dig deep into the why of their behavior, and they may not know. So we were able to really help reconstruct that survey tool and the data that was going to be collected on that project. One of the big things that really came out of our CAB participation is we had the chance to tour the Reentry Opportunity Center, which we call the ROC here. It's attached to the jail. And it was dreamt up with a great vision, and it had all kinds of work and funding that went into it. And right before it was scheduled to open, the 12 members of CAB were invited to meet over there. And if you had a camera of our faces when you walked in and captured the looks, everyone who walked in who had been incarcerated said, "Oh my gosh, this feels just like jail. I would never come here." Other people who had been in different psych units and mental health hospitals said, "Oh my gosh, these are the colors of a mental health hospital," and immediately felt, in their words, icky, sitting in this space. And so the individuals who had worked so hard on it said, "Oh my gosh, I didn't even think about any of that." And even though we've decorated it and we've put some plants and some additional lighting in, it still looks like the cinder blocks of the inside of the jail, even with some paint on it. And so that was a real eye opener, I think, for some of the stakeholder partners, that lived experience has to be engaged early. And that's also to answer the question that came through: how do we really make bold decisions based on lived experience and not just pretend that we're listening? I think that is one of the key elements, is lived experience, nothing about us without us. starts at the beginning. And that's something that when we go up to the Capitol to advocate, we say that, we carry signs around that say nothing about us without us. And that doesn't mean come to us at the end of the project and ask if the project is good enough to roll. It means engaging lived experience very early on to really drive the strategy and the vision of that project. So we learned that as a community together. And now, believe me, everything that happens over at that rock gets run by us before it ever goes into action. And I think we've created a really good kind of standard of practice for that. We were able to engage a nonprofit organization that had some funds, and they were like, gosh, we'd really like to start providing this in the wellness court system. We'd like to offer this at recovery houses. And they didn't really know what to do with it. And so the wellness court contact that we had said, why don't you talk to CAB? And so they brought, I'll tell you, it was Not One More. Some of you may have chapters of them in your area. So the Not One More York chapter came to us as a board and said, well, what should we do with this money? We want to spend it on this community, but we don't know what would be appropriate. And so we had some really good discussion. And what came out of it was very different than what they were planning to do with it. And so I think it was a really valuable conversation for everyone involved. We discussed the plans for the Wellness Diversion Center, and this was another, small win that I think that we changed the perspective of the individuals who are working on that project. We talked a lot about coming out of incarceration and needing a primary care physician, needing a dentist, needing connected to all of these services. And the CAB members sat around the table and said, yeah, that's great, but I can't eat. I don't know where I'm going to live. I don't have a winter coat. My kid doesn't have school supplies. I don't have socks. I don't have boots for work. So while it's great that you've set up this diversion center and it's going to help us, there's different components of that, and it's going to help connect people to the health care that they need. Coming out of jail on the first day, the last thing that a lot of people are concerned about is the last time they've been to a dentist. And so, women coming out haven't been to the gynecologist in 10 years. So offering that to them in their first week out, that's not of any interest to them. And so it really helped to reframe what the needs are of individuals. And while the data does tell us, yes, that people don't have a primary care physician, it doesn't help us see the priority order of that. And this CAB did. It shed light on where that falls in the priority order. And so that is going to shape some of the services that are provided through this diversion center. And then we were also able to meet with another county and provide information on how we started our board, what the CAB role we play, and have some really great conversation with them about getting another CAB started in their county. You mentioned COSUP. COSUP is here in York. There are some funds allocated to York County for those who are justice involved and also struggle with substance use. And so we were able to participate in the needs assessment focus groups for that. The chair, myself, and our vice chair were engaged in an interview process during that needs assessment to sort of give information on what our CAB has experienced. So we've really had an opportunity to give feedback in ways that have proven to be meaningful. But I will say that we've also experienced some of the things that you talked about, Kate, and that the individual questioned, is that we have given feedback and felt like it went nowhere. And we've lost CAB members because of that. It disengages them. They feel that tokenism. It feels like a checkbox. It develops a mistrust of the system partners. And we have had quite a bit of turnover because of it. So the things on this webinar are all really pertinent, and they're things that we are working on right now as a CAB. Next slide. Actually, I think, Catherine, I wanted to turn it over to you as a stakeholder to just kind of talk about how we got started and what your experience has been with us.
Thanks, Becky. You did phenomenal. I feel like there's nothing I should add, but there is. So for those who do not know me, I am Catherine Groover. I work at the Department of Probation Services in the County of York. I am the CIT coordinator and a Stepping Up project coordinator for our county. So for this CAB, it was a grant that we received from our PCCD to really have this CAB up and running. And Becky mentioned we have had this for 3 years now, but we have learned a lot. in the last 3 years. And Becky did a really good job of overview of some of our barriers that we faced, challenges, turnover, and then all of the wins that they had, that they accomplished. But this did not happen overnight. 3 years of hard work and dedication from our CAB members and stakeholders really made this as a team effort. And the biggest thing that we really ran into is having really raw conversations. And this was an opportunity for stakeholders to really sit down with those who had lived experiences and have honest conversations. And it could be difficult. I know I shared with the CAB board members that, you know, at the first couple of meetings, like I was really shy and really hesitant on saying something because I didn't want to offend anybody. And it's really important to build engagement and rapport. And for me, it was a little easier because my sister sits on the CAB board. So I have that background knowledge, but the other county stakeholders, it's really good to leave your ego at the door and no one's above anybody and just sitting down and having honest conversations. And I remember telling the board members, if you have a problem with the probation department, I want to hear about it. Like, I want to hear how can we improve so that better people have better outcomes when they come into our office, and really stressing that. And one of the feedbacks that Becky had alluded was we have to be mindful of the stakeholders here to constantly ask CAB, what are your thoughts, suggestions, ideas? So they don't feel like they're doing a checkbox of that we presented this information, but we're not asking for their feedback. We're just kind of getting their buy-in so they spread it across the community. And having a CAB board and live experience at the table is to really, truly understand what is going on, that reality versus perception. And this is where you really get those conversations going on what are things that we didn't think about. You know, research says this and data says this, but what is really going on? And you get a true perspective of reality instead of saying, well, this is what best practices is. That's not always the case. And just modifying it to what's going on in your jurisdiction or what are reoccurring trends that we are seeing so we can overcome them together. So this has been a great opportunity to really learn for those individuals that walk the path to really help guide us and give us the opportunity to have them be involved in decision making instead of us deciding things and rolling out in the community and things fall through. And that's what we hated. And that's what we were seeing is we implement things, it didn't work, we lost funding, or we couldn't sustain it because of all these hurdles. And if we would have had people that lived experience at the table of these certain projects, we would have been able to have a better outcome. We would have been able to sustain these situations. So we learned in a hard way. And that's why this CAB board is super important because it has helped pave us to sustain some of the projects that we are working on because we want that because it really helps with connection to care and helping those individuals who actually are reentrants or have substance abuse, mental health, our advocates, anybody that's in a diverse demographics that we have at CAB to really help those individuals. Attending board meetings are really huge. So we have individuals around those other stakeholders, judges, district attorneys, public defender, prison, other county stakeholders and elected officials, commissioners are at the table that they can actually hear this information. And it really helps with pushing what we really need to see what happens, and it really gives them that empathy to really help change what needs to occur so we could get the goals that we are trying to achieve and the outcomes here. One of the other major things with the CAB member is we had one attend our CIT Academy, and that was huge because we got a perspective of the outside of a live experience individual sitting through with correction officers, mental health providers, and advocates during that week. And they were able to provide us feedback of pros and cons to the trainings, how can we improve? And we actually implemented that. We implemented with certified recovery specialists coming into during our week to really help with decreasing the stigma of drug and alcohol substance issues within our first responders and mental health community and advocates, to really discuss what else is there we can do for the overdose responses and everything. So that was really huge when it came to it. I also just want to say, telling community members that we're all in this together, so no one feels like it's us versus them. And that's what we learned at the beginning is, who's gonna come up with the agendas, it's the stakeholders, the CAB board members, and really empowering them and having a voice and telling them that we are here to support you, but the CAB members should be leading everything. We'll bring ideas to you and get your feedback, and you tell us also what is going on, what is a barrier and challenge that you're seeing, and how can we work together to fix this problem. So just from the county stakeholder perspective, it is phenomenal to have this in your county. It takes time, having conversations, building a rapport, and discussing how you can help, but having honest conversations. And like Becky alluded earlier about us really focusing on to make sure that we keep CAB involved, and we keep them involved at the beginning instead of later on. And again, implementation's messy, you're going to make mistakes, but when you have that open forum and that rapport, you can have those conversations and improve and build up on. And since we did that, we have been able to achieve a lot. So I will turn this over back to Orlani, I think.
Yes, thank you, Catherine.
Okay.
So now we are at the point where we want to hear from you. If you have any questions, please continue to drop them in the Q&A section or in the chat, and we'll be able to respond to them. I see someone already posted a question, but I wanted to follow up with Becky and Catherine on the first question that was asked, because one of the important components that LEAPed spoke about was transparency. And one of the things that, I'm always sharing with people that I work with on community engagement is the importance of being transparent with what we're going to be able to do with the feedback or with the suggestions or recommendations that they give us, whether it be when we're doing listening sessions, when they're filling out surveys, or when they're at the table with us working on policy. It's what is our intent for what they're bringing to the table, for what they're sharing. And then also, what is our limitation? Like being very upfront with people and transparent with them about that. And so I wanted to ask you, what has been your experience about that in all of this wonderful work that you've been doing with the CAB in York County about setting expectations and being transparent?
So that was something we had to really come up with bylaws with the county and the CAB members. What is the stakeholders' expectations of the CAB and vice versa? And that is sitting down, like Becky probably remembers, but we had a couple meetings discussing that and really outlining that. Like CAB members asked the county folks, what do you need from us? Okay, well, we give you feedback. What does this look like? What is the time? Transparency is huge. You really need to have that open line of communication. And I know you can't always share everything, but there's really nothing you can't share with CAB. I mean, everybody understands funding, grants, budget items. That is not going to be all upfront, and not everything can happen overnight. So I think it's just important that those engagements and conversations, and Becky can probably speak a little bit more of this, but we did run into that. And after a year, we really got our momentum because we really figured that out. And that's why it's really important to have bylaws and really having those conversations and setting it up like a board. So hopefully that answers your question.
Yeah,
And
agree.
I think too that we have another question in here, and I'm going to bring it up because my feedback about this actually kind of addresses both. But one of the questions, in addition to what you just asked, is someone is maybe everyone can see this, but someone's part of a pretrial service organization. Do other organizations feel pushback from frontline workers when implementing suggestions of people with lived experience? And the reason I wanted to bring that up is because I think that in looking at the way that we give feedback and the way that we as a board set our expectation, I think that we need to really refocus that initial slide that Orleni talked about, the difference between lived experience and lived expertise. And that has really, we have found that to be a really big part of the CAB, and it is kind of reshaping what we do. And the reason for that is because someone with lived experience who has not worked or has who's not able to bring a professional tone or doesn't have some of the knowledge needed for some of the conversations may come in with demands and ideas and thoughts that are really not feasible. And we've seen it happen where individuals at the table are saying, well, why can't we have this? And, you know, really, we should be doing this. And if people are not able to have these conversations with a little bit of background of that expertise, it can make that conversation challenging, and the individual walks away feeling unheard because their ideas were really not feasible to implement in the first place. The other thing that happens is, to the individual who just asked this recent question, it lays out that sometimes lived experience can't be trusted. If we come to the table with grandiose ideas of how we want to completely change a system to work for us, like everyone should be able to get into treatment whenever they want to for mental health, we don't have enough beds for that, no matter what systems we come up with right now or changes that we want to bring. Some of those things just aren't going to be able to happen. And so if we come out of left field with our ideas and we present them as things that are not feasible, we can be seen as really not valuable feedback. And so to answer the question about, you know, how do we make sure to set the right expectations? The more one-on-one that we can do with these different entities, inviting stakeholders for very specific agenda items and having that direct feedback with them, not just a feedback form that we all put together and send over to the jail, but we had the warden himself there where he was able to say, oh, that's a good idea, but we're probably never going to be able to do that. And here's why. And then that helped the lived experience individual hear, oh, I see that's probably not realistic. So it's having that really good two-way conversation and really having the in-person dialogue, I think, is critical. But it's also, you know, something Kate talked about was training for how individuals with lived experience share that experience and expertise. And it's really, really important because if we are out there in left field talking about how things used to be this way and we really want to see them this way, and with no real valid knowledge of that, that's where lived experience gets excused from the table. And it does just become a check mark because, well, we engaged them, but we really can't use what they gave us. And so I think it's really twofold on both sides, having the right people, setting the right expectations, and then making sure that the lived experience is trained in how to bring their story.
Thank you for that, Becky and Catherine. I'll add on that question too that was just recently asked about staff. That's why it's important for an organization or agency to state the purpose and to back it up with the values. If a value of your organization or the work that you do is engaging community, is respecting and valuing what people with lived experience can bring into your space, that is something that begins by creating a community-oriented mindset in your staff, in the way that things get communicated. When I was a practitioner in pretrial, we trained staff on that. So speaking to training about, we had a lot of communication and conversations with staff about our plans, about why we thought this was important. So we made staff like a part of this. And so at the end of that process, they were very excited and engaged about wanting to bring people a lived experience, about wanting to get their perspective, incorporate what they shared. And so we had to create that environment for staff. And I know that it's sometimes easier said than done. And there are certain spaces within the work that we do in criminal justice where that's just not how things have been said, and change can be very challenging for people who are used to doing things in a particular way. But what I'll say is that beginning that line of communication, beginning to tell staff why it is that something's happening this way, what is the value, what is the outcome, how it correlates to the work that they're doing, and how it is helpful to them as well at their level is just as important. There is sometimes, we focus all this external engagement, either upwards with other system stakeholders or outward with community, and we neglect our own staff and our own people in terms of engagement. If there are any other questions, please drop it in the chat. But I do have a question. Oh, yeah, I just think.
Thanks.
Yes.
I will also say that we started off looking at kind of big picture systemic changes, and I don't want to, underestimate the power of just some shared perspective that has come out of our CAB, talking with some of the individuals, getting a chance to really hear what some of the stakeholders go through on a daily basis. To hear that the administrator of York Adams Drug and Alcohol is very aware of these challenges, but that sometimes her hands are tied by the state. That alone was helpful for us at the CAB to hear, because it made us aware that it's not a lack of understanding, empathy, or knowledge. It's a matter of there's regulation and policy that we didn't even know were tying the hands of our county officials. And so it just gave us some perspective to know that they hear us, they are frustrated too, and they share in some of the challenge. And I just don't want to underestimate just some of those simple conversations, because sometimes we didn't get into big systemic changes, but just to kind of give a little bit of here's where I'm coming from, here's where they're coming from, was invaluable as we develop these partnerships.
And that's what takes time, is educating each other on the systems. And then really trying to figure out, okay, how can we work together? Or how can we achieve what you guys want? Maybe it'll look a little different. And what are your thoughts on that? And that's what we ran into for the first year, is just really educating and truly understand, because the county stakeholders has an idea of what happens, but then Becky or someone else will say, no, that's not actually how it happens. And that's why I said reality versus perspective, like what is really going on, but we perceive it that this is what's happening, when in reality it's not happening. And then what can we do to improve it or help those?
And I wanted to ask, you spoke about challenges with when expectations are not met, or what people felt tokenized within this work in the CAB, that you've lost people. I wanted to first ask, what other elements that you consider in recruiting people with lived experience, community members? And then what mechanisms you have now in place to recruit people when you need it, when someone moves on or decides to step back?
So so when we first started, we kind of, Catherine and the other stakeholders who developed this used other agencies to make referrals for who they thought would be members of the community with lived experience who could participate in this. And that's how we got our first 12 members. From that point on, we determined through the development of our bylaws that all of the individuals coming in and out of the board would be determined by board members. And so we wrote that right into our bylaws, that they be recruited by and voted in by the 12 CAB members. We didn't expect to have nearly the turnover that we did, and it was definitely a learning curve. But as seats opened up and we would look around the table and say, wow, 8 of us are white women, we probably need to look at some diversity on this board. We would then start looking at different communities and different organizations for more diverse backgrounds. And I will be honest, we recruited for specific members of the BIPOC community, where we knew that we really couldn't have another white female on the board if we were going to represent York County adequately. And so we did recruit for background, ethnicity, and we worked hard to go to organizations where we knew that they might be able to point us in the direction of some new individuals that would meet our needs. We also looked at holes in experience. So we definitely did some gap analysis on, you know what, we've got a bunch of people here who've been in county prison. We have no representation from state. We have nobody on this board right now who's done state time. We know there's a difference between county and state. We really want to recruit somebody who's been in state prison. So we looked at, you know, not only the background and ethnicity, but the experience that people were bringing. So we were really well covered on all of the different agencies and recovery and reentry stories that we had.
Becky, I don't know if you want to touch base on compensation. So I know when you guys attend, I know they asked Kate, but we also compensate for our CAB members. So Becky, if you want to go into that.
Yeah, so that's been another discussion item that's really interesting. There are some CAB members who honestly are just happy to have a voice and to be in the know of some of these really exciting initiatives. I'm one of them. Then we have members who probably, you know, wouldn't attend monthly board meetings if they didn't receive the $50 stipend, because the $50 in gift cards, we give the gift cards for gas stations, grocery stores, Amazon, Subway. And so if they didn't have that little incentive, they have acknowledged that for them, you know, they do really value the compensation for their time. So it's probably a split of who really values the compensation and who feels that it's just sort of the right thing to do. But it is definitely a best practice. So I've learned to offer compensation to anyone for their lived experience, the time that they give.
And I'll just, before I turn it back to Kate and Megan, just briefly highlight that in the document, the lived experience document, there should be a link or a resource to Urban Justice Center, who did a whole deep dive into this particular topic.
Oh, that's great.
So I turn it back to Megan to close us out.
Thank you all so much. Great conversation. And I continue to learn every time we engage in these conversations, and can't thank our panelists enough for coming today and spending some time with us. You know, I think there's a lot of things that resonate from what we heard through the LEAP and continue to hear in terms of the thing that sticks with me most, I think, from today is that balancing best practices with lived experience. You know, a lot of the work we do at the Justice Center is promoting best practices, right? But you're absolutely right that we need to be thinking about how to balance that with the perspective of lived experience and expertise, because it doesn't always play out the way that we think it's going to on paper. Getting buy-in at all levels, right? From frontline staff to leaders and supervisors to you know, your community leaders, et cetera. Just trying to get everyone involved is really important. So yeah, I think this has been great for us. I hope it's been enjoyable for everybody that's been able to attend. Our contact information, my contact information, and Kate's contact information is on the screen here. Feel free to reach out to us with any specific questions. We're happy to get you connected with Lenny or our colleagues from York County that attended today. And again, I can't thank our panelists enough and everyone that attended today. Have a wonderful rest of your day.